let's dive into your expertise, Dr. Sangeet. You are the expert on hormones. So, what exactly are hormones?
So, if you open any kind of medical book definition, just look at it that, our hormones are basically, it's chemical messengers, and it's produced by our endocrine glands. Endocrine gland could be anything from pituitary, like, where it produces the growth hormone, or even pancreas, where it secretes the insulin. Then you talk about the thyroid, there's a book just now about, underactive thyroid. You look at the free T3, T4, TSH, and you have all these glands like ovaries, estrogen, progesterone, the testicles, where it produces the testosterone, so on and so forth. So now what happens is all these hormones basically through the bloodstream, it goes to our organs, our tissue, where it exerts its bodily functions. Right now, and it's very important that all these basically, when we talk about the bodily function, it goes into our cells. So it exerts its cellular healing or, functions, right? So when we talk about addressing the underlying cause, we always look at this particular, what are the triggers where it goes beyond, the hormones. We've got to look into our nutrition. We've got to look into our gut health. We've got to look into our sleep, how we manage our stress. So all those things, and exercise are so important. So everything, all healing begins in cellular levels. All healing starts from our gut health.
So, what do hormones do in our body?
So each hormone will have its own function. So when you talk about thyroid, hey, it's very important in terms of metabolism, right? So when you have whether it's hypothyroid or hyperthyroid, just the opposite, either your metabolism gets affected. So either you lose so much of weight in hyperthyroid, or Graves' disease, or Hashimoto's, over time it becomes, metabolism slows down, then you end up gaining weight. And, the one thing that I've actually learned, the thyroid is so important, especially for women, not just women, but for men, because it governs everything from head to toes. When you talk about, the immune system, I've seen a lot of patients who are diagnosed cancer. When they come to me, their T3 is only sitting at 2.9, 2.5, and they are all unaddressed. It's not even corrected. So thyroid also it's very important when it comes to the immune function. Okay, and then when you talk about the heart health, arrhythmia, so your thyroid has to be optimum, because if it's like too low, even hypothyroid, when you have all this mixed edema, but that is only towards an extreme, ultimately you go into heart failure because it affects your heart rhythm, right? Arrhythmia and all that. So each of it will have its own function. Then you talk about the estrogen. So the estrogen levels and all that, it varies right from puberty to, pregnancy, and then to menopause. So estrogen itself, when you talk about governing, whether you're talking about your youthfulness, your collagen, your mental health, and mental health is so important, right? When you talk about hormones, whether it's thyroid or whether it's the estrogen, and being, the cognitive function, when it declines, you just realize that you have brain fog, you have like, so all the hormones it actually governs. So testosterone is also another thing where most people think it's only linked to libido. Do you know how many women are diagnosed ADHD when they're going through perimenopause, menopause? So testosterone to me is also very important, just not for men, but for women. So women may require only a very small amount, but that small amount has got such a profound impact, not just, it goes beyond the sexual health. It's for your mental health, the cognitive function, the mental clarity, the reducing ADHD, to our muscle mass, because we lose a lot of muscle, like about 15% in a decade once we are hitting perimenopause towards menopause. And then you talk about the bone density to prevent osteopenic osteoporosis. So it has its own functions there as well. Yeah, so we can go on talking, about hormones and each of it and its function.
What is I heard you mention this term optimum range or optimum number, because usually, when you take a blood test, there's a range, and sometimes the range could be so wide. So what is optimum number or range?
Yeah, so that's something that I first discovered, which I thought it was also life changing for me, because conventionally we are taught, right, if the range is between, let's say they put 1 to about 11, as long as it's within the range, even though it's sitting at 2, it's considered as normal. But what was truly life changing for me is you have to hit that optimum. So optimum means you try to address, make it 75 percentile. So between that, from 1 to about 11, I would say it's about 7.5, because the optimum level is a true determinant of how a person look and feel. It's bringing us back in our 35s, or, especially around that particular age group where we function optimally. So even though we are in our 40s or already in our 50s, I always try to keep it as optimum level.
Well, this is a new concept for me also because before this, I mean, when we're practicing, as long as it falls in between this normal range, like, okay, there's nothing I need to do, or it's almost like there's nothing else I can do for you. I remember saying that to the patient, like, it's already this, even though you have all the symptoms, but it already shows it's normal. There's nothing more I can do. I remember this was the thought process I had when I was sitting in the clinic treating patients. And yeah, it felt so disempowering that I could not do more for them.
I was there too until, my own personal journey that led me to this anti-aging, and my mentor, it was really life-changing. So we've all been through that, but, now I guess there's more awareness. Thankfully, after that, when I first started practicing this hormonal balancing, that was back in 2007, 2008. We were known as quack doctors. It was really challenging at that time because we were questioned by the endocrinologists, by the gynecologist, but thankfully today it's known as integrative, it's known as functional medicine, and it's widely endorsed. So sometimes I feel my personal message to all doctors out there is just believe in yourself.
Mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact